leave and get the tax credit is still available to employers. It is now optional though. It's not mandated anymore. They can provide the leave and still get the tax credit starting April 1st, but it is not a required leave now. They've also expanded the reasons a person can use that leave and an employer can grant that leave to include getting a vaccine, and then also recovering from injury or disability or illness related to COVID. So you don't have to have COVID, but you have a secondary condition related to COVID, are now reasons that an employer can choose to provide and receive the tax credit for the leave. Just a couple pieces of information with regards to how this is applying going forward in terms of the American Recovery Act. The IRS hasn't come out with guidance yet, so I would encourage employers who would like to continue to do this and keep this option available to them to keep checking with the IRS for guidance as to how this is going to apply and how you actually get that tax credit. So there are some questions still there about it, but the voluntary ability to provide it and get a tax credit for it does go forward. It's just not required anymore, as was originally in FFCRA back at the end of March.
Yeah, thank you so much. A lot of our questions in our working groups kind of focused on whether or not people would be able to take that leave if they became ill following the vaccine. Like a lot of people are having symptoms, so that's helpful to know.
Yep.
If people have questions for Erin right now, if you could type them into our Q&A box. I know I forgot to go through all of my nice, here's how you use Zoom, and here's who our wonderful partners are today, but just kind of backtrack our partners here today. We have some folks here from One Community Health. We have Jason Bradley, and we have Gladys here. So we're glad to have them. We also have some folks here from Hood River County Public Health. We have Dr. McDonald from North Central Public Health. Erin's here from Boley. We have Claire from the next door here as well. So we have great people, so you can ask all of your questions today. And my mouse broke, guys. So I'm using the trackpad on my laptop, so things are not moving as smoothly as I like them to. Just a brief introduction to Zoom. What we really want you to do today when you're asking questions is to use that Q&A box, and you'll notice the Q&A box is at the bottom of your screen. That's going to be the easiest way to get your question answered. So the chat box is great if maybe I forgot to add you to a panel, or you want to say thank you to people who are participating today. The Q&A is really for your questions. So please put the questions in the Q&A box for me. Nate Stice has 2 addendums to leave. Nate, you should be able to speak.
Good morning, Nate Stice with Governor Brown's Regional Solutions Program, and thank you, Erin, for hopping on the last minute to be our expert on leave. I just wanted to add a couple things that are kind of related to leave that I think folks should be tracking. Is under the Oregon OSHA temporary rules, employers do have to allow for people to take quarantine. And when they're done with quarantine, you have to allow for folks to have their job back. It works a little bit different with sort of temporary employment, but just want to make sure that folks are aware that under the OSHA rule that you have to allow for quarantine. Did I get that right, Erin?
Yes, and I just want to add to what Nate is saying is that is also in the permanent rules they are considering. So if all goes well for OSHA, and I mean from a continuum standpoint, the temporary rule will become a permanent rule, and that requirement will continue. I do want to add one thing to what Nate said is for those employees who do have leave under OSHA, and it may not be paid leave available to them, there are some resources to encourage those employees to reach out to for potential paid leave or some supplemental income during that time. One is a program that's still at DCBS. It's called the COVID Temporary Paid Leave Program, that under certain conditions, essentially Those conditions in a broad stroke are a person does not have access to any type of paid leave program. They can apply and receive up to $120 a day during the time that they have to quarantine. And then there is another program that is, I'm just bringing it up here. The Worker Relief Fund run through the Community Foundation is another support program for workers who don't otherwise have access to either an unemployment issue or leave, paid leave if they have to quarantine. So there's a couple of resources to support those workers from a paid standpoint, particularly if the employer is unable to access those tax credits or wants to pursue that potential, just given, I imagine, the uncertainty around how that's going to work until the federal government comes out with guidance. So there are some resources there to support those workers who have to go on leave or for quarantine reasons.
I know that you have all worked with your employees really closely throughout this whole thing, and I know that you'll continue to work and think about what's best for their health in this, and offer that I'm a resource and everyone else here is a resource. And I also just wanted to add that I hope you'll think about how you can help your employees schedule and think about getting the vaccine, including probably the best way to get folks in there is during working hours. So appreciate your considering that and thinking about how you protect the health of your workers and being here today.
And I think Erin Roby might be on later today to talk a little bit about what she's been doing on her farm to get folks vaccinated. But somebody has a question. If someone has to quarantine, is claiming unemployment an option?
So I'm gonna shoot from the hip here. So ultimately, that's a question for unemployment. You know, they're gonna say you have to apply, but generally no. Generally no. If they're not unemployed, they have not left service of their employer. And the assumption is that they are quarantining and coming back to a job because it's protected leave, either under OSHA temporary rules, or the employer has provided them, or they have access to some type of leave from their employer, whether it be paid or unpaid.
And Claire from the next door just put in the chat box for everybody a link to the Oregon Worker Relief Fund, quarantine fund for Oregon agricultural workers, and then a number that workers can call to apply. So we passed out, I think, some flyers about that last year.
Mm-hmm.
I think it came a little bit late for cherry season maybe, but we definitely had that available for pears last year.
And if I remember correctly, OHA put together a really kind of comprehensive resource of leave programs and different resources available to workers and information about the different types of program. I can't remember when that was last updated, but it wasn't too long ago in which I had some communications with them about that, and that may be part of information that was passed out at some point in the recent past.
Thank you so much, Erin. Do we have any other questions about leave or about vaccinations with leave? All right. Thank you so much for joining us today, Erin. I know you'll be here until around 10:30.
Mm-hmm. And I'm just putting my email and my contact information in the chat box, just in case questions come up, either after I leave or frankly, at any point during any conversations you guys have going forward. I'm always available to answer questions or get to a bottom of a question if we don't have the answer for you.
Thank you so much. Somebody says they're not seeing the link. And Erin did put that up for all panelists and attendees, or not Erin, Claire from the next door. So you may need to scroll up a bit to see it. I can also send that out in an email. Erin did also leave her email here. So if you have questions, please contact her directly. All right. So I'm going to hand this over to Dr. McDonald. I'm going to try to move through her slides for her. Mimi, does this look right? It's a good screen view. It's not like the presenter view or something.
Well, I think what I'm seeing is the main slide and then the next one up.
Yeah,
So
it's doing the presenter view and I can't get it
that's okay.
off of here today for some reason. So I'll just, let's see. That make it better or is that the same?
Amazing. Nope, that's perfect.
Wonderful. All right. So I'd like to introduce Dr. Mimi McDonald. She is the health officer for North Central Public Health District. That's Wasco, Sherman, and Gillum counties. Thank you so much for being here today, Mimi.
Oh, it's my pleasure to be here. Thank you, everyone who is here listening in. I'm really grateful. Erin and I were talking about how this is possibly one of the first times spring also brought a little bit of a worry to us again. And although also hopeful time, happy to see buds on the trees. And you all did such an amazing job looking after people, taking care of workers, keeping safe places to work that and we have a lot more tools. So I think this will be even much better. So purpose of today's talk, I'd really like to, I'm just going to focus my part of the talk on COVID-19 vaccines and kind of how the interaction with the workplaces, and hopefully to provide it's pretty basic information, but then also generate some questions. And I won't have all the answers either, but this is a great place to start. So next slide. There we go. Thanks, Ash. All right. So what I thought I'd do, I'll describe just again in brief the different vaccines that we're using in the United States, some of the efficacy data, the safety data, and then some of the logistical considerations that I think employers will have around timing, cost, all of those things that I can give you answers for, some FAQs to go over, and then leave it up for everyone's questions. So next slide. All right, so probably everyone knows at this time in the US, there are 3 COVID-19 vaccines that have been approved under emergency use authorization by the FDA. So there's the Pfizer vaccine. So that one is given in 2 doses, 3 weeks apart. There's the Moderna vaccine, which is the one that's been predominantly used in our region, which is also 2 doses, 4 weeks apart. And then most recently, it's alternately called the Johnson & Johnson or the Janssen vaccine. We're just going to refer to it as J&J. And that is the 1-dose vaccine that's been approved and has been in use over the past couple of weeks here in our region. Okay, next slide. Okay, sorry, but there are some things that I think are important to point out about some slight differences between these vaccines. So we're going to start off on the very top line. The Pfizer vaccine is approved for use for adults 16 and up. The other 2 vaccines are available for those 18 and up. The mechanisms of how the vaccines work are just a little bit different. Pfizer and Moderna work along a very similar with a sort of a direct vaccination of the mRNA material. The Johnson & Johnson vaccine uses something called an adenovirus vector DNA. And so it's a little bit different. That technology has been around a little bit longer, and we'll get into that, but end result is basically the same. Other logistical differences that happen in our area and also kind of impact which vaccines are available in our region. You guys probably know, again, the Pfizer needs that ultra cold storage. We have not been administering the Pfizer vaccine in our region, mostly because of that. However, we do have ultra cold storage available in the region at both at Columbia Medical Center and at Providence Hospital. So that is the potential for the future. The other one, Moderna, arrives frozen, and the Johnson & Johnson is even more portable. It's refrigerated. Some other logistical things, both Moderna and Johnson & Johnson come 10 doses to a vial, which may not seem like it's a big difference between 5 doses to a vial on the Johnson & Johnson vaccine. But that, oh dear, it says you may need to restart room. I'm seeing restart Zoom. Oh, okay, that's for one person. I'll just keep going, Ash, until you tell me not to. So important things to know. how long from your first dose until people are fully vaccinated? There's a crucial difference here, especially, kind of the timing of the growing season, in particular cherries, and when people are getting vaccinated. So the Pfizer vaccine, from the first dose that people get, the soonest that they would be considered fully vaccinated is 5 weeks after the first dose. Moderna, it's 6 weeks after, because there's a longer time frame. And then the Johnson & Johnson, it's just 2 weeks after that first dose. And so then, as I mentioned, Pfizer is not currently being administered in Wasco and Hood River counties, but that doesn't mean it forever won't be. Moderna and Johnson & Johnson are. I tossed this in at the bottom. You may or may not have heard anything about this. There's been information that has come from the Catholic Church, which does have implications for a lot of people who are receiving the vaccine. The Catholic Church has written a monograph deeming all of these vaccinations acceptable. However, there is a caveat that if people are given a choice, that the Pfizer and Moderna are preferred over in the Johnson & Johnson. I will not go into the logistics of that, but just something to be aware of, that you may get these questions from workers. So next slide. Okay, whew. So safety, I'm going to go over some of the concerns. So concern about the technology being new. So the mRNA vaccine technology has actually been around for more than 10 years. And the adenoviral vector technology has been available for more than 30 years. So although the sense is that they sort of created out of nothing, from a year ago, but it's really, the technology going into it has been in the works, and there have been adenovirus vector vaccines given for over 30 years, as I mentioned. And actually the first vaccine, look this up, was administered in 1796. So humans have been giving vaccines for quite some time. Now, other concerns that you may feel or have heard is that this process was rushed. And what I will say is that this process definitely had a much shorter time frame, but I would not say rushed, because every single one of the vaccines that's been approved has gone through all of the safety protocols and studies that have been needed to do for them to be approved. So the phase 1 studies, those are small, they look strictly at safety. As long as it's completely safe, they go into those phase 2 studies, where not only do they look at safety, but they're like, what is involved is there an immune response? And then the phase 3 trials, which you guys may remember hearing about, is it safe? And then does it work? So those are the much larger trials, and all of these things have been studied very, very well. And then, of course, there's the ongoing study that's happening right now, where millions of doses of these vaccines are being administered across the world, and they still are safe. So short-term risk. Is there a short-term risk? Yes, there is a risk of anaphylaxis, that sudden allergic response that people can have, that can be life-threatening. That is absolutely correct. That is a risk. It's between 2 and 5 in a million people who get the vaccine. Now, the good thing to know is, of course, all the places that are administering the vaccine are well aware. Any place that if this were to happen, have a vaccination clinic maybe on site at a employer's workplace. All of the equipment that is needed to treat anaphylaxis is there: epinephrine, Benadryl, all of those things that are needed for immediate treatment. And then, at the bottom, as I mentioned, we have this real world data going on. Over 125 million doses of COVID-19 vaccine have been administered in the United States. The microscope on looking at the safety of these vaccinations is incredible. And so we feel very confident that this would be considered a very, very safe vaccine. Next slide. All right, so what about long-term implications? Well, I'm being a little sneaky about this, because I'm going to talk first about the long-term complications of COVID-19. So, because this is a risk and benefit thing. So what do we know about the long-term risks of COVID-19? Well, we actually know even when people who have recovered can still have heart and lung and kidney problems. There have been significant reports of people with mood difficulties and some with cognition. You guys may have heard like COVID fog brain, things like that. And of course, we do know that COVID-19 does have a mortality rate. So there is a risk of death from contracting COVID-19. So what do we know about the long-term risks of these particular vaccines? Well, beyond a year, we can't say for certain that we know, but we do have a lot of biological models to say that it is completely safe, and based on all the knowledge of vaccines that have been given over the years. There's some things that I just had to say because this comes up all the time. This vaccine, none of the vaccines make people sterile. There's some of the things that have come up on the internet. There's no microchip implanted. Bill Gates does not have anything to do with this. These vaccines do not alter a human's DNA. So in terms of long-term risks, again, of course, I cannot say because it hasn't been around for more than a year, but really very, very strong evidence that there are not long-term risks to receiving the vaccine, but we absolutely know there are long-term risks associated with getting COVID-19 infection. Thank you. Next slide. All right, how well do they work? The Moderna and Pfizer ones, 94, 95% effective in preventing symptomatic disease. That's completely fantastic and amazing, and highly unexpected. I mean, it was going to get approved if it was even 50% effective. So Johnson & Johnson vaccine, you also may have heard some of this. Is this not as good of a vaccine? And here's what we know. The studies that were done in a different time and place with the Johnson & Johnson vaccine. Here's the data. So it is 66% effective at preventing moderate disease, 85% effective at preventing severe disease, and 100% effective preventing hospitalizations and death. So as you probably know, the Johnson & Johnson vaccine was created and developed and tested when some of the variants that had popped up, especially the South African variant, were sort of in play in the population that was tested against, which may have a reason why that it's not, the efficacy is not as great, but still, these are all fantastic vaccines. As we say, which vaccine should we get? And the answer would be the one that is offered to you. These are incredibly effective. Next slide. All right, so what do we know? Well, we know that it prevents people from becoming ill, but does it prevent transmission? So some really exciting data just came out regarding the Pfizer vaccine. And this is data from Israel, which really, they really were able to vaccinate a large portion of their population relatively quickly. So what was discovered? The Pfizer vaccine was 94% effective at preventing asymptomatic transmission. Unbelievable, just fantastic information, and 97% effective at reducing the symptomatic disease. So again, it's those real world studies that are, again, sort of backing up the initial studies, and very exciting. Also to know that you probably heard that B.1.1 strain variant, the UK variant, that was actually circulating in the population in Israel. It was actually the most prominent variant. So we know that the Pfizer vaccine, and because they are very, very similar, we're assuming the Moderna vaccine as well, are very, very effective at preventing transmission. Next slide. Okay, so this is kind of the heart of the matter. So logistics around vaccine administration. So I sort of, talked about all those other things, like what does it mean, for a workplace, for employers, for individuals. So as of March 29th in Oregon, all agricultural workers are eligible to receive the vaccine. Before that, there was a program through OHA where some of the FQHCs, federally qualified health centers, including One Community Health, were encouraged to actually vaccinate some migrant and seasonal farm workers kind of ahead of the state schedule. And I realized that caused some, absolutely some confusion. It was one of those things that was meant to be helpful, but also can be confusing. And I wish we'd been able to do a better job just of conveying that information. However, bottom line, everyone is eligible as of March 29th. Important, the cost. There is zero fee for this vaccine. The vaccine itself, people cannot charge for it. However, what can happen is that if a provider would like to bill a person's insurance, just for the cost of administering the vaccine fees, so sort of like not the medicine itself, but just for giving the shot, they are able to do that. However, if a person were to have like a copay or anything like that, those providers cannot try and collect that money from the person. So bottom line, there is no charge to people who receive the vaccine. And it doesn't matter if you have insurance, don't have insurance, you're a resident of Washington, you're a resident of another country, doesn't matter, no charge. So just hopefully that will put people's mind at ease. Now, where are we going to give these? There is the potential for having what we call kind of pods, points of suspension at workplaces, and that may have already happened. Also, we have clinics in Wasco County. We have been providing a lot of vaccines up at the Armory, and that's a potential too, but this is going to be kind of worked out with different employers. But we absolutely do have the capability of going to a workplace, because we also understand for some people that is probably going to be the most effective way to be able to provide them information and provide the vaccine. If an individual has gotten their first dose of a different vaccine, of the Moderna vaccine in particular, maybe, for example, in California, and then they come here and they're due for their second dose, certainly we are able to give that second dose of Moderna. We are instructed, and it's really sort of that we do not like to mix vaccines. So if someone got a first dose of Pfizer and all we have is Moderna, or then we would not recommend giving that second dose of Moderna. All right. So that's another important thing to know. And then, vaccine education, so important. So just as I'm, hopefully being able to speak to you all and answer some questions, there's just so much, as you know, can sometimes contradictory, some misinformation and confusing information that's out there. So what we hope to do is to be able to provide to employers and their workers education in a way that they are feel comfortable receiving it, and they have a time to answer their questions, or to ask questions and have them answered. And then so there can be kind of that space where people can make decisions. And so we really want to work with people to help that happen. And we know it's tricky, but that's the dream. That's what we're all kind of working for. Next slide. So logistics. Oops, we want to go back a little bit. Okay, there we go. Thank you. Which vaccine? As I said, the best vaccine is the one that you can get. So at this point, through the health departments and through providers, it's not so much that people kind of, employers or individuals get to choose. It's like, this is what we have, because as you know, the supply is still limited. This is what we have. This is what can be offered. So that's what's available. Okay, so that's something to know about the administration now. As was alluded to, this is a very sort of granular thing, but oh my goodness, what happens to my workforce after people get the vaccine? So again, with the Johnson & Johnson vaccine, there's only one dose. Pfizer and Moderna, there are two. Moderna one especially is 4 weeks apart. So there's definitely the possibility that people will either have had, get their first dose or their second dose during their time of employment while they are here in the region, or of course, for people who live here, obviously. What can that mean? So we know that about 55% of people have some type of systemic side effects. So all over total body, not just the sore arm, just about everybody gets that. But so they may have fever, chills, nausea, vomiting, diarrhea, body aches. And what we have observed is that these tend to be more, younger people are more symptomatic. So in other words, those for once, some of those of us who are older kind of get off the hook a little bit. Usually it's not such a bad thing, but you will have workers, if they get their first dose or their second dose, even more, truly will not be able to work safely the next day. Not that they're contagious or, going to make anyone sick, but they absolutely may not be able to get out of bed. So something to think about when you're administering vaccine to a lot of people at one time is a timing of this. So the Johnson & Johnson vaccine, the first dose of the Johnson & Johnson one is kind of like the first dose of Moderna and Pfizer. But again, that second dose, when people get it is the one that tends to really pack a punch. For those of you who've gotten the vaccine, you know what I'm talking about. And that really can cause workers to be out for a day or two. So again, just more logistical questions, things to think about, and things we want to work with you all. Okay, next slide. All right, so now sort of some logistics about policies in the workplace. Now I'm not going to go over, there's of course so many other issues, but just if people are vaccinated, do they still need to wear masks? Yes. Do I still need to do the same sanitizing? Yes. Are we still encouraging the same spacing? Yes. So that part hasn't changed. What one really big important thing that has changed has to do with people needing to be quarantined if they're exposed to someone who has COVID-19. People who are fully vaccinated, so 2 weeks after their vaccine course is finished. So again, that's, 2 weeks after their second dose of Moderna or Pfizer, or 2 weeks after the first dose of Johnson & Johnson, fully vaccinated people do not need to quarantine if they've been exposed to someone who is infected with COVID-19. Caveat, of course, as long as they're not sick, as long as they don't have symptoms, right? But as you all remember from last year, this is a big deal because you could have a family where one person might be infected, but then the entire rest of the family or the rest, the rest of the people who traveled together would be required to be in quarantine. And that is just not the case for people who are fully vaccinated. So I think this is important information to get out there. I would hope that it would not be seen as coercive, but it's just the reality of it. So there have been some changes from last year as well. So even if a person is unvaccinated or maybe they haven't completed their course, you guys probably know that the the quarantine time has been shortened. Now we're requesting people to be in quarantine for 7 days, as long as they're asymptomatic and they have a negative test on days 5, 6, or 7, 10 days with no test. All right, so that's been a change. So that time can be shortened. I mean, you can still certainly ask people to be out for 14 days, but logistically speaking, 7 days can be a much shorter time frame. So that's already been in place going for the past couple of months, but for people who may not be as familiar with it. Okay, next slide. All right, some FAQs. I may have gone over this a little bit. So what about doses given in other states or other countries? So we're doing what we can, and I know OHA and Maria can speak more to this, about finding out information about the vaccines that are being given in other states and other counties where a lot of your workers may be coming from. And as I mentioned, if we have second doses available, we absolutely can give them to people. Vaccines given in other countries. So Mexico at this point has, I think, it's either 5 or 6 vaccines that they have authorized for use. So you may hear that your workers, and I hope you encourage them all to bring whatever information that they have been vaccinated with the Sputnik vaccine, which was developed in Russia, or the Oxford AstraZeneca vaccine. Please have them bring that vaccination information. All of that counts, as it were. So that information will be vital. Those vaccines have been fully vetted, and they are, considered just as reliable as the ones that people are receiving here in the United States. Talked about, are the vaccines interchangeable? The answer to that one is no. Do people need to have insurance? No. Do they need to show their insurance card? If they have them and they are able to do that, that is great. At some places will request that, but people do not need to be concerned. They don't need to show ID. They don't need to show social security numbers. Any of those things. Again, they might be requested in some cases, but they are never necessary, and they would never keep someone from getting a vaccine if they don't have that information to provide. And then one other one, do I have the right to ask my workers about the vaccination status? The answer to that one is yes, if you think about it. So certainly hospitals, schools, everything have the ability to ask for documentation of someone's vaccination status. So that is definitely within the rights of an employer. And of course, as we mentioned, can have some big implications for what happens with your workforce. Let's see, next slide. All right, so if you have specific questions, I was going to put Ashley's email up here first, but I want her still to be my friend. So I'll put my email up there. So if you don't already have like a connection and you have vaccine questions, certainly Wasco, Sherman, and Gillum, and would gladly also answer Hood River questions, but for Wasco, Sherman, and Gillum, I have my email address up there, mimim@ncphd.org. But this is certainly not only a health department run show, it's a team sport involving everyone and including all these agencies and entities that I've listed here and some that I haven't even listed. So I know it can be a little bit confusing, excuse me, but our hope is that even if if you reach out to one agency or organization with your question, even if they don't know the answer, we are all in a lot of communication together and working really hard to make this growing season successful and try and keep everyone healthy as much as possible. So I think that's it for my slides. I have one more maybe. Oh yeah, so that's it. So that's it for me. Again, I don't have all the answers, so ready for questions, and you don't have to ask them now. You can always email them or find us at a different time. Thank you so much for your time.
Great. So I am going to stop sharing this screen so we can see all of our panelists up here, and then we can start, we're going to start asking some questions. And we have a lot of great panelists here today, so they should have some good answers for you guys. So one of the questions that came up is if your workers come and maybe they already have a dose of the Pfizer vaccine and we don't have Pfizer here, is there any way we can get them that Pfizer vaccine?
So that is a great question. And that's something that we're going to be working on the logistics of that. And I think the answer is going to be yes. We're going to work with, because it's going to come up more and more. And certainly within Oregon, the Pfizer vaccine is available. And so we will work and try and figure out, does it mean that your workers will have to take a field trip to Portland to the airport vaccination place, or does it mean that we will be able to procure some and start administering it here? I don't have the answer, but we're definitely going to be working on that because that's something that we want to be able to provide for people.
Also, who is handling the Washington workers? I would suggest contacting your local public health in Washington, so Clickitat County Public Health. And Gladys and Jason, do you work in Washington as well?
No, we do not. We've been trying to work with the Washington Department of Health to find a way to provide vaccines in their state, and haven't been successful as of yet, but we're still continuing to try that. But for now, no, we're not. And I would recommend to contact those health departments in Skamania or Clickitat counties.
Thank you. Somebody asked, are all the proffered vaccines utilizing the mRNA and adenovirus DNA?
The ones in the United States that are currently authorized, yes. So Pfizer, Moderna, mRNA, and then the Johnson & Johnson is the adenovirus vector vaccine.
I had no side effects after the J&J vaccine. Is that common?
Yeah, well, if you think like about 55% of people have side effects, then you're one of the lucky 45%. So yay, you.
All right, so I've finished our questions so far. I've got a ton of questions. So we know there's a lot of vaccine hesitancy in the community, and let's say somebody's worried about getting it because they feel like they might have some underlying conditions, maybe diabetes or high blood pressure, or they're pregnant, and they don't have a primary care provider. Who should they talk to or contact?
I'll let my friends at One Community Health take this one first.
You go, Beth.
That would be us. That individual would contact our clinic, and we would help get that individual an appointment on site on either a Wednesday or a Friday with at Hood River or the Dalles clinics.
And at our offsite vaccine events, we will have providers with us that can be available to have answer questions while we're out there too.
So has there been any movement towards using the J&J vaccine primarily on farm workers that are coming into the region because it is just a one-dose vaccine?
That's a big yes on that one. There have been a lot. There's been a increase from OHA in dispensing that specifically for this purpose. So yes, that's and it is, as we pointed out, you know, it's safe, effective, and works a lot quicker.
The question that I think is probably on everybody's mind is, how do we get an appointment, or what should we do to register our workers? And I'm sure all three of these different organizations on the line today have different ways of doing that. So maybe all three of you can go one by one and answer.
Absolutely. For us, if you are a grower and you have 100 or more employees, we would like to create on-site events to ensure that everyone is vaccinated on site. If you are a grower that has 100 or less employees, then we welcome you to have your employees come to our clinic on either a Wednesday or a Friday when we do have in-clinic appointments. We do require what are called jot forms. So if you are a grower, we really need your support in ensuring that we have name, date of birth, basic demographics for your patients before we can actually go ahead and administer a vaccine.
And if you look on our public website, we have a special page for orchardists, and a contact us for information about obtaining a vaccine. And it will just provide some quick numbers from you as the orchardist of how many permanent employees you have, how many seasonal employees you think you'll have, and that will help us to plan our outreach events.
And from
McDonald, go ahead.
Oh, sorry about that, Darren.
No, go ahead.
So for North Central, we're not quite necessarily using that 100 person distinction. However, we're really encouraging, and I love that idea of just putting a direct link on your website, but certainly if you are interested in, say, you know, more than just a handful of employees getting vaccine, then please reach out to me directly, because one of the things that we can do to make life a little bit easier is kind of give some block times so that employers can know, okay, so between 2 to 5 or between 5 and 8 p.m. That my employees are going to be able to get vaccinated at such and such a clinic. So we're going to try and work with that. So even if it's not necessarily on site, and if it's, say, at the Readiness Center, that we can work with that. So just please, you can get in contact with me. You can also just call the main office number and they will get you in contact with me as well. So that's kind of how it's working there. And then
I can go next. Ashley, I may have missed introductions, and I apologize if so. I'm Darren Ryan. I'm with the Hood River County Health Department. I work as a COVID-19 response coordinator. So happy to share updates for our health department. And I am really happy to report that we are moving to open scheduling next week. So up until this point with the health department in Hood River County, scheduling for vaccine appointments has been by invitation only for specific groups in the phase protocol by OHA. And as of next week, we will have open scheduling for anyone who is eligible through Group 6, which Group 6 is the group that agricultural workers and migrant seasonal farm workers are a part of. And so early next week, we will on our website, our COVID-19 website, which I'll put in the chat, you can sign up for appointments if you self-identify into a group through Group 6. And moving forward, we'll have large vaccine clinics on Thursdays. And by large, we're hoping to do about 750 vaccinations each of those clinics. And these are in person. So we host them at River of Life Church here in Hood River. And we also, for any individuals who have trouble accessing online or don't have access to internet, we do have a call center that can help individuals sign up for appointments as well. And I'm also excited to report that we do have 2 pharmacies in Hood River too that are also vaccinating people who are eligible, which is Walmart and Safeway. So I think it's great that the county now has several options for people, especially Dr. McDonald talked a lot about symptoms that come up from vaccines. And so sometimes staggering appointments can be really helpful for your workforce if that's something that you're interested in. So I'm happy that we do have several outlets in our county where you can get vaccinations. But I'll put both the call center phone number and the website where appointments will go live next week in the chat.
Ashley, I want to answer some questions that I see up on the chat. As Dr. McDonald mentioned, One Community Health was one of those clinics that was granted permission to go ahead and start moving forward in the phase and vaccinating people ahead of time. And we have done so. But we have also been, there have been a lot of growers that have contacted us, a lot of employers. We've had over 100 that have contacted us. So we are working our way through all those phone calls, all the job forms and voicemails to make sure that we are getting information back to growers on how to sign up. Also, we have created a frequently asked question to answer specific questions about the MyChart appointments that we did hear a lot of response from growers, and we are trying our hardest to not make it more challenging on you guys, but this is information that we do require as a federally qualified health center. And at the end, our goal is to ensure that no patient ends up getting a bill for the administration fee of to be vaccinated. So I will share that frequently asked questions with Ashley. If you are a grower that has more than 100 employees and you need help with these job forms, Claire Rawson is a good contact at the next door. They are available to support agencies or employers complete those job forms, and we'll give all that information out to Ashley to send to all of you.
And then if I can just jump in there too. So one of the things that I just wanted to kind of be clear about. So kind of there's a little bit of trying a division of labor that is happening with one community health, trying to work directly with some growers and organizations, and Mid-Columbia Medical Center and NCPHD. We've kind of teamed up together to sort of work on the other sort of large group. So that's not necessarily set in stone, but just kind of in general. So if you hear from, if you call one community health and they say, could you please call Mimi at NCPHC? It's not because they don't like you, but we really are trying to divide the workload to just make sure that we can get resources to everyone.
So we have a lot of other great questions here too. So if somebody really wants to get the J&J vaccine, is that being offered right now by any of your organizations? I know it's offered at Bimart, so there's some questions. Can we just send people to Bimart to get vaccinated?
With Bimart, you may have to call ahead because sometimes they get Johnson & Johnson and sometimes they get Moderna. The first go around, they got Johnson & Johnson. I think the second one, they got Moderna. But if they are offering it, absolutely go there. And then again, I know both NCPHD and One Community Health do have access to the Johnson & Johnson vaccine. And so, logistically speaking, we can give you more detailed information about when those, how to sign up for that in particular.
And the Johnson & Johnson supply has just been unreliable at this point too. So we can't really project out and say this date we're going to have Johnson & Johnson, because we're not finding out until Thursday or Friday for the next week if we're actually going to get it or not. But it sounds like the supply is going to get more consistent throughout the month as it starts coming down, and we may be able to have those options for people.
So the next question is, who exactly is eligible as an ag worker? Is it just field workers? Is it the farmer themselves? Could it be office workers that come into a lot of direct contact with workers in the field?
So it's everyone. When they, if we think way back to when hospitals were very first, they kind of tried to prioritize maybe respiratory therapists or people who or intensive care unit nurses, but then it got down to the entire hospital staff. That's the same thing. So it goes for everyone. So you don't need to kind of worry about like, do I need to make this decision? Who is vaccine worthy or not vaccine worthy? Everyone's vaccine worthy, but you know what I mean.
So is there a good place we can find a list of all the comorbidities and underlying health conditions that would qualify someone to get vaccinated now besides farm workers? And I know I've shared some of those links with our farmers, but it might be helpful to put that link in the chat again today.
Yep, there are 10 specific conditions. And if you go to the Oregon Health Authority website and look at the vaccine phasing, it has those diagnoses out there. And those come from the Centers of Disease Control. These are the conditions that have shown to have the worst side effects if people are infected with COVID.
And just to know, people will not be, you don't have to show proof of that or
Right.
anything like that. These are, I'm just going to say they are loosely interpreted. So.
So at the time of your vaccination or your employee's vaccination, will you then schedule a time several weeks out to do that second one at that time? Okay.
Yes. For those who were calling, I was shaking my head. Yes. Sorry.
And for us at Hood River County Health Department, we collect your phone number and or email, and we contact you to schedule your second dose. For
And we're
Moderna, if it's Johnson & Johnson, obviously, we don't need to.
Okay. And One Community Health is scheduling at the time of the vaccine that should come in.
Can people who qualify by age use the open scheduling next week, or do they still need to wait for their PCP to contact them?
You'll be able to schedule next week with us. Yes, anyone who's eligible through Group 6 can sign up for a vaccine.
Do we have any other questions today for our panel? So Mimi, I do have one question for something you said earlier. You were mentioning that you can ask your employees for proof that they've been vaccinated. And I know this is still kind of it's still in the experimental stages of a vaccine. Do you know if that's still true that you can ask them for that? I have some concerns about telling people to ask their workers for vaccine information, just because it could become a legal issue if you deny employment to somebody who hasn't been vaccinated, and they may have concerns health-wise about getting that vaccine.
Oh, that's such a good question. And I think that the big distinction there is, can you request information? But can you deny someone work? And those are, two completely separate things. So that is a really great point. And I'm wish our BOLI folks were on still, because I think they would have a much more concrete thing. I guess I was speaking sort of in general terms. Is that something that is reasonable for employers to know? And so the answer to that question is yes. But I think that's a great question, and hopefully we can get it in writing, I think would be really important. But again, I would encourage, even if it ends up being for whatever reason that people don't have, or that is not something that employers can do, I would definitely ask employers to have their workers bring whatever information they have, because you'd be amazed at how many people get their vaccine and they're like, Pfizer, Moderna, I don't know which one it was. So please ask them to bring whatever documentation they have, bring it with them if they are traveling from somewhere.
Yeah, and I've kind of told orchardists who have contacted me with that concern that, just make sure you're talking to your legal counsel to make sure you're doing all of the right things and taking all of the right steps in that way. We also have Claire from the next door here today. And Claire, do you want to talk about some of the sort of opportunities and ways we can help our seasonal farm workers this coming year, and what sort of things we have going on? I'm sorry, I'm not very articulate today.
No worries. Sure. So we are still trying to continue all the other ways of supporting farm workers. In addition to the vaccine, I know vaccine is really on the forefront of all of our minds right now. But in addition, we are trying to keep in mind that we will at some point, need continue to need PPE. We'll need to remember that we need food access resources for farm workers who are arriving, all of those kinds of things. Working with Migrant Ed to plan ahead a little bit, and thinking about what those supports will look like in the summer as more of your crews arrive to the area, and wanting to make sure that all the usual supports are in place in addition to vaccines and testing as well. So I will say, for those of you who don't know, the Next Door is not an administrator of the vaccine. So we are not a health center or a health clinic like so many of my colleagues on the call right now. However, we are trying to make sure that we can just lend capacity wherever possible. So we have community health workers and outreach workers who have been attending some different clinics, and they can provide interpreting on site at vaccine clinics. They can provide support, as Gladys mentioned. They can provide support with registering employees, some of your employees in the JOT form that One Community Health has, because that's a process. And so our community health workers are able to come on site to your orchard and talk with each of your employees, get them registered in that system, so that they'll receive a call when their appointment time is scheduled. And that's just to support One Community Health and getting people registered, but also support you all, so that that you aren't having to do that for a large group of employees. So we'd like to be able to lend some support that way. And then another thing that our community health workers are offering is on-site education. So some of our outreach workers have prepared small presentations, similar to what Mimi gave today, which was so full of amazing information. Thank you, Mimi. And able to give some of that information in Spanish on site. So many of you had One Community Health come out this past year to give information on COVID prevention and education, which was so valuable. And One Community Health is in the midst, along with our health department, of doing vaccines now. So we are here to support with that education piece, so that they all can continue doing the vaccines. So if that would be helpful, it's completely free. You just would need to contact our outreach workers, and I will give their emails and information to Ashley to send in a follow-up email to you all. And all you'd have to do is contact them and schedule it with them. They've done a few outreach events on site in Hood River County, and they are able to go throughout the gorge. So that is a resource available. We know there's some folks who are really excited to get their vaccine, and there's others who are still on the fence and really want more information, similar to what Mimi shared today. So those are the ways that we can support, and we'll continue supporting our colleagues on the call here with Spanish language and in any way we can. But that's kind of what we've got going. And I'm also, sorry, one more thing, Ashley. I did share a video here. We have a team at the next door who has been creating Spanish videos throughout the pandemic, covering everything from hand washing to mask wearing, physical distancing. But they recently have created videos on the vaccine that really just feature leaders throughout the gorge, and specifically in the Latino community, sharing why they got the vaccine. So kind of giving some of their story. And the link that I shared here is specifically for older adults. So thinking about maybe your employees, but especially family members of your employees, and the importance of well-being and health for the entire family. So please feel free to share that link. And we do have another link, or another video that's being created, and I will share with Ashley when it's finished. And that one will be more for adults of all ages, not just older adults. So please feel free to share those. Those will be going out to the community. They will be on monitors and TVs in different stores throughout the community, so that people are seeing them as they go about their day. So thank you.
Hey, Claire, can you please put your contact information into the chat box so anybody that wants more information can contact you? And I have sent out some emails about those videos that Jess at the Next Door is making. And you can contact Jess to get on a mailing list to receive those videos in your inbox or as a text blast every month. So if we can also share that information, maybe Jess's information, that would be really helpful.
Right. I think I will share Jess's information, who is one of our outreach workers and is also doing the on-site presentations. So I will share that in the chat.
So I'm not sure how many people on the call today used either One Community Health or MCMC's educational services last summer, but I will say that everybody that used them, based on our survey data, every person that decided to use those organizations really saw a great benefit from doing it. And I can't say that highly enough. This is a wonderful opportunity to get good education to your workers. It's a free program. It's an incredible opportunity that I haven't really heard about in other states. Oregon's really doing an amazing job with this. So please use it.
Ashley, I also want to add that all of these organizations collaborate on the education material, and we all share it so that it is all consistent regardless of whatever county that you're in for Oregon side.
And Gladys, will you be offering that educational opportunity again this summer?
Maybe, depending. So what we've been doing is a lot of our, we have a show on Radio Tierra that plays 10 o'clock every Wednesday. We have a registered nurse, Sylvia Maciel, and she gives information specific about vaccines and anything health and wellness. We've collaborated with the Next Door to work on plain language education materials, also videos. So we'll have more and more education going out, but for right now, we are unable to provide on-site education for folks prior to a vaccine event.
Good to know. Thank you. Maria Castro, do you want to really briefly discuss the survey that you asked us all to send out recently and how that's going?
Oh, yeah, sure. Thank you. This is Maria Castro. I am a Hood River County resident, but I also work for the Oregon Health Authority. And I'm part of the team that is working on response for COVID-19 on agricultural workers. I think last week, probably you received a survey. We developed a survey so we are able to support our local public health authorities on reaching out to agricultural employers. We asked some questions about, who you were, how many employees do you have, and if you were willing to have a workplace event, if you were willing to work with one of our local public health authorities or local community health centers. So in that way, we have received over 650 responses, and that total around 30,000 workers that are eligible for the vaccine. So all that information is going to our local public health authorities. So if they haven't had the opportunity to reach out to you, now they will have that information that shows them that you're interested or either receiving information or having a workplace event. And if local public health authorities and community health centers need assistance, because we know we have a ton of people to vaccinate, our team stands ready to support. We are requesting Johnson & Johnson vaccines, so because we understand how important that is for our agricultural workers. We are actually getting ready some mobile teams that are able to support. So we are here to support our local public health authorities and community health centers, and we are happy to provide information or resources. So we just stand ready, and I appreciate the invitation. I love to hear all the work you're doing. It makes me very proud as a Hood River County resident and as an OHA worker. So thank you all for all the work you're doing.
Ashley, I want to add to Maria's comments. We are, One Community Health is working with both health departments so that we can have mass vaccine events, specifically during the influx when we know that migrant seasonal farm workers will be here for harvest. So we're planning on the last week of May, first 2 weeks of June for mass vaccine events. And once we meet with both health departments, we'll set dates and then we'll release that information out for growers to have their folks get vaccinated.
And one last thing, I just wanted to make a comment. Because of that connection we have with our local public health authorities, we're working with California, Washington, and Idaho to make sure that we sort of have some level of coordination among the states, especially around agricultural workers. So because of the work that Dr. McDonald is doing, they were able to provide us some ideas of the counties where the workers were coming from. So we reach out to them. So we know most of the counties that are coming to at least to the cherry harvest are coming from the same areas, and they're using Moderna vaccine. So at least we know that. I know that doesn't mean that everybody's going to be able to have a Moderna vaccine, or probably we will have some, others that have another type of vaccine. But this is a type of coordination we are trying to do to make sure that, that we assist our workers, and also ensuring that when they come here, they know which vaccine they got, and when did they get it, and when did they need it, to eliminate any barriers that they might face.
Thanks so much, Maria. And I don't see any other questions coming in from our group today. So this is your last chance to get any questions in. I do want to reiterate a couple things, right? Okay, so this is a no cost to your workers, this vaccine, right? H2A workers will qualify to get this vaccine. Let's see. As farmers, you too will qualify to get this vaccine, even if you're not above 65 or have one of those comorbidities. You too are an agricultural worker, so you are qualified. Is there any other big points I'm missing here besides, get the vaccine if you can?
And then I just, because Stacey Cooper put this in the chat box just about, and I'm not actually sure if the welcome packets come from the growers, but if they do, this was a great suggestion that the workers, when you send out welcome packets, remind them to bring their vaccination information, especially if they need a second dose. 100% yes, because that is the more info we have, the better prepared we're going to be. So that would be my final piece of information, is just remind people. We always tell people to take a picture of their card. Almost everyone has a phone, so that helps a lot.
I was just going to say that, Mimi. We encourage pictures because little cards are easy to vanish.
Oh, and then Stacy, thank you. She said they come from Migrant Ed, that a lot of the welcome packets. So we will coordinate with the next door and to make sure that that message goes out. Thank you, thank you, thank you.
Yeah, definitely take a picture. I remember we had a lot of people losing business cards and losing things last summer, which was making things a little more difficult. So definitely encourage people to take a picture. That's a really good idea. All right, this presentation was recorded, and I will put this on our OSU YouTube so that people can revisit it if you have questions or want to get more information or miss something. And Claire just put Jessica's information from the next door into the chat box, so you can take a look at that. And I will also send out a follow-up email either this week or early next week with some more of this information for all of our farmers. And hopefully Mike Doak will be willing to amplify that message. Great, thank you all so much today. Thank you to our wonderful panelists.
Thank you.